Hello there. Welcome to another episode of Rare Diseases. Rare Disease Review is a not-for-profit medical journal organized by students from the University of Toronto, McMaster and Western University. This podcast is created by the branch of Western University. The podcast aims to advocate for rare disease awareness and promote student involvement in the rare disease community. We appreciate your listening and support today. For further information on scientific translation of rare disease information, please visit www.rarediseasereview.ca. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, so please always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. My name is Song, and you're listening to the Rare Disease Podcast. For this episode, we're going to talk about the Buerger's disease. The Buerger's disease is also called thromboangiitis obliterans, and it's an inflammatory disease that most often affects small and medium artery in the patient's feet or hand. Buerger's disease usually causes the patients to feel pain, tenderness, or burning sensation in the lower limbs or forearms, including feet and hand. These symptoms are caused by blood clots and can lead to ulcers and change of skin color on the skin to pale, redness, or bluish. Buerger's disease is a disease of blood vessels. However, it's not atherosclerotic related. Instead, it is associated to dysfunctioning of the immune system. Today, we're going to talk to the master graduate at Western University, Christina Zhong, to learn about Buerger's disease and how pro-angiogenic therapy is a potential effective treatment for Buerger's disease. Hi, Christina. Thank you so much for joining us today. We're happy to have you on the podcast.
Thank you very much for having me. I'm excited to be here.
So before going into Buerger's disease, we'd love to learn more about you. Can you tell us a little bit about your background?
Yes, I'm currently a biochemistry master's student at Western University, where I'm studying in the area of intussusceptive angiogenesis. So for background, angiogenesis is the generation of new blood vessels, from pre-existing vessels. There are two major modes of angiogenesis, sprouting and intussusceptive angiogenesis. Sprouting angiogenesis involves the sprouting of new blood vessels from existing ones. It is initiated when there's low oxygen, which promotes local cells to secrete a protein called vascular endothelial growth factor A, or VEGF-A. The inside of blood vessels are lined with endothelial cells, and when these cells are exposed to high concentrations of VEGF-A, the cells differentiate and initiate the process of sprouting angiogenesis. The other form of angiogenesis is intussusceptive angiogenesis, which involves the splitting of pre-existing blood vessel into two. This process is mediated by the formation and expansion of transluminal endothelial pillars, and the regulation of this form of angiogenesis is regulated by many molecular signals, including VEGF and angiopoietin-2. Studies also suggest that blood flow rate is also an important regulator of this process. Compared to sprouting angiogenesis, the regulation behind intussusceptive angiogenesis is poorly understood, and this is attributed to a lack of good in vitro models to study it. Therefore, our lab has created a microfluidic device to model this blood vessel, and we are currently investigating the effect of different flow rates on pillar formation.
Wow, that's fascinating. So with your background in angiogenesis, could you tell us about the angiogenesis-related rare disease, the Buerger's disease?
Definitely. Buerger's disease is a rare disease that is characterized by the blocking of the blood vessels in the hands or feet, resulting in a lack of blood flow to those areas. Buerger's disease predominantly affects young and middle-aged tobacco smokers, and exposure to tobacco is a prerequisite for developing this disease. In the United States, it affects about 12.6 to 20 per 100,000 people. However, it's much more prevalent in parts of Asia and the Far and Middle East. For example, in Korea and Japan, 16 to 66% of cases of peripheral artery disease are represented by Buerger's disease.
So it seems like it actually affects a lot of people all over the world. What is the known cause behind this disease and what is expected for the patient to experience?
Currently, the cause is unknown, although tobacco exposure is required both for disease initiation and progression. The mechanism is thought to be an autoimmune disorder where the body's natural defense against viruses and foreign organisms begin to attack its own body. Genetic factors may also play a role since the prevalence of the disease varies between ethnic groups. In most cases, the first symptoms of Buerger's disease are pain in the lower arms and legs while at rest. Other symptoms may include cramping in the legs when they walk, sores or ulcers on the extremities, numbness and tingling when exposed to cold temperatures, and or inflammation and clotting of certain veins. In severe cases, the individual may develop critical limb ischemia, where there is a significant reduction of blood flow to tissues, resulting in gangrene or tissue death of the affected limbs.
Well, that sounds very severe. And it's interesting how the manifest looks very similar to other disease. So could you tell us a little bit about how it's diagnosed and what kind of treatment is available currently for Buerger's disease?
Of course. Diagnosis consists of an examination of the individual's medical history, symptoms, lifestyle choices, blood tests, and imaging tests to assess the tissue damage. Important considerations during diagnosis is ruling out other diseases with similar symptoms, such as atherosclerosis, frostbite, diabetes, and autoimmune disorders. There is currently no cure for Buerger's disease. However, there are a variety of treatment options depending on the severity of the disease. Tobacco cessation remains the best treatment. Symptoms usually improve when an individual stops smoking, and in some cases, complete recovery may occur. If the individual does not stop smoking, however, other treatments include drugs that prevent blood clotting, drugs that increase blood vessel diameter, drugs that prevent inflammation, antibiotics, and drugs that relieve pain. In some cases, surgical procedures such as cutting nerve pathways to relieve the pain, also called sympathectomy, and bypass procedures to bring around the blocked blood vessels may be required. In the case of critical limb ischemia, amputation may be required.
All right, so it sounds like these are the previously available treatment, and I heard about pre-angiogenic therapy from you and its application to Buerger's disease. And could you tell us a little bit more about that?
Yes. So besides smoking cessation, treatments for Buerger's disease remain limited. Traditional surgical treatments that restore blood flow to the blocked blood vessels are ineffective for Buerger's disease due to the lack of suitable targets for surgical intervention. Due to this, a significant proportion of patients with Buerger's disease will require amputation. Thus, there is a large need for other treatments. And as you mentioned, one area of investigation is pro-angiogenic therapy. And what this does is the endothelial cells that line the inside of the blood vessels is stimulated to create new blood vessels to restore blood flow to the affected areas.
That's very interesting. So how does this research develop the therapy?
Approaches under experimental study include injecting DNA or viruses that express genes related to blood vessel formation and stem cell-based therapies that help to regenerate the blood vessels. In response to a lack of oxygen in blood vessels, local cells secrete various factors such as VEGF, hepatocyte growth factor, and fibroblast growth factor, which lead to processes important for promoting angiogenesis. Thus, gene therapies deliver plasmids that encode for these factors to promote angiogenesis. Stem cell-based therapies use stem cells to regenerate blood vessels. For example, bone marrow-derived mesenchymal stem cells, or MSCs, can promote tissue generation, such as endothelial cells to promote angiogenesis and fibroblasts to promote wound healing. Gene and cell therapy have been tested in clinical studies with patients diagnosed with peripheral artery disease, critical limb ischemia, and or Buerger's disease. And improvements have been found in wound healing as seen in reduction in ulcers, pain during rest and walking, and improved density of blood vessels. Despite these promising results in randomized controlled studies, there's a lack of strong evidence to suggest improvement in hemodynamic factors and amputation-free survival. New areas of study that modify the current stem cell-based therapies and gene therapies include using a different form of gene therapy called adenoviral vector delivery to deliver E-selectin, which has promising pro-angiogenic as well as anti-inflammatory effects. There are also studies on using exosomes from MSCs to get around limitations in MSC therapy. All in all, it is crucial to have a better understanding of the precise mechanisms regulating angiogenesis to find novel therapeutic targets.
So thank you so much for joining us today. And this has been a very informative interview. We're grateful for your time and the amazing research you have shared.